I've served on 2 commissions now. You mentioned Domenici Rivlin, but I also served on Simpson-Bowles. They came to roughly the same conclusion because the arithmetic drives you there. It's not a partisan thing. We can't solve this problem unless we do 2 things. One is reduce the rate of growth of healthcare spending, and there are different ways of doing that, but it's got to be part of the mix. And the other is raise more revenues, because we can't absorb this many older people and their health care without more revenues, unless we're basically willing to close down the rest of the government. And there are things we need the government to do. Taking either the Simpson-Bowles or the Domenici Rivlin or the Gang of Six, or all of these proposals, which are all roughly the same, and putting together a bipartisan deal seems to me essential. The president knows that. He tried to do that in the negotiation with Speaker Boehner. It is, again, very difficult because the extremes in both parties are not very enthusiastic about tax increases on the Republican side or changes in Medicare and Medicaid on the Democratic side. But he's got to do that. I think everybody knows that. After the election, perhaps beginning in the lame duck session, I hope we will see a deal. It's got to be a bipartisan deal, and it's got to include entitlements and more revenue.